Okay, here comes another recording. Same case, IMZ, rescue mission here. Almost complete. We have the two IMCs in place. Now we're dealing with the dilemma of the seating, and because there's an adjacent natural tooth, the slot is binding, and it may be something internal. So the way to find out now is we're going to go ahead and spray the undersurface with Quick Check, and this is color red. And we'll just go ahead and spray the entire undersurface and we'll find out where we're being hung up here. Okay, so this is what, it's a nice thin layer of red indicator. And now we're drying all surfaces, including the attachment. So my dental assistant is doing that now, and I will slide that slowly into place. Let's see where the binding is. That's the hard part. See, so that goes down in there. There it goes. Alright. So we'll wiggle that a little bit. Back and forth. And then we'll look underneath and see what we have as far as adjustments to make. And nothing so much internally. There. So I'm going to use a fine diamond. And fine diamond that will leave less abrasion, much more accuracy. And just go gently in here. So that's probably the point of binding. I'm thinking if orthodontically, if it's shifted, it could be the very first point of insertion. So that'll be the least problematic way to go. And then we'll spray that area again. Could also be the connector itself right in here. Let's see if that frees it up. Okay. Now we're going to just continue to dry. Let's see if I can slot this a little better this time. Here we go. Okay. See, there's the insertion. Let's see, where these bottom out. We got to come more lingually. There it goes. That's getting better. Starting to come down now. Yep. Down again. Just slight gaps now. Very slight. So we're on the right track. That's good. Now, let's see if I find the resistance. And see, it's just with finger pressure. You just kind of go buccal-lingual. And now, don't blow air, but let's just look at the device. Okay, well, there's a lot of red areas in the mouth, in which you can assume that's binding, but sometimes you can see a shiny spot on the attachment and then go to the associated area. Notice near the soft tissue I see a shiny spot, and it's I have a perio probe, and it's right here. There's the shiny spot right there. So that's what I adjusted, and that tells us that we're on the right track. So I'm going to do the same thing again and say maybe that'll free it up just a little bit more, and I'll seat back over here away from the mouth. And we see it binding in there again, right? So that could be the pressure enough to keep us away from seating properly. So again, yeah, and we should eventually see the inside of these bottoming out with indicator spray that's missing in those areas. Okay, so again, fine adjustment here, and no dryness. Spraying again, indicator. Yeah, it's indicator spray. Oh, today, yeah. Oh, yeah, yeah, yeah. A perfect day for it. Valentine's Day. Okay. It's seating more, but there it goes. Okay, so you want to push down on the more on the prosthesis. Oh yeah. Okay. Well, by my pushing down here, I'm looking for buccolingual. We can go ahead and now thread down into that. And as it threads down, it'll orthodontically start to apply pressure to this tooth on the end here. So we'll do one more adjustment, then we'll go ahead with the screws. All right. Looks good. There's less burn through now. A little on the buccal side. Notice there's less movement buccolingually, but there's movement apically. That attachment's not seating all the way because we know that natural teeth have a tendency to move, especially around an implant, out from around it. So I'm going to go ahead and get this now in a cleaner, and when I come back we'll put this in with the screws. I have to also trim the screws. This one has to be trimmed 7 millimeters less than what it is now, and we'll go ahead and do that, and then we'll be able to finish Ron's case up perfectly today. All right, see you on the next